भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Seeking blessings from Master Samuel Hahnemann. We are highly indebted to the Master Samuel Hahnemann who taught us dare to be wise. With the blessings of our Guru, Dr. Prafull Vijayakar sir, who has made this science very easy. Homeopathy is mathematics. Jai Hahnemann, Jai Homeopathy, Om Vijayakaraaya Namah. We are starting with the Organon of Medicine, Samuel Hahnemann's 6th edition, aphorism number 3. So we have, as far as since 2 days, we have completed aphorism number 1 and 2, and this is the third aphorism. So what Master told us in this aphorism, if the physician clearly perceive what is to be cured in disease, that is to say, in every individual case of the disease, knowledge of the disease and its indications. If he clearly perceive what is curative in medicine, that is to say, in each individual medicine, knowledge of medicinal power, and if he know how to adapt according to clearly defined principle. See, in this of aphorism number, Master Hahnemann has mentioned that if physician has this quality and this knowledge, then he is master in homeopathy. So this is he has made. So we'll continue this aphorism further. What is curative in medicine to what he has discovered to be undoubtedly morbid in the patient, so that the recovery must ensue, and to adapt it as well as in respect to the suitability of medicine most appropriate according to its mode of action to the case before him, so that choice of the remedy, the medicine indicated, as also in respect to the exact mode of preparation and quantity of it required, a proper dose and the proper period of repeating the dose. Then finally, if he knows the obstacle to recovery in each case and is aware how to remove them so that restoration may be permanent, then he understands how to treat judiciously and rationally, and he is a true practitioner of healing art. So, in this aphorism number, Hahnemann has mentioned if you want to treat judiciously and rationally and want to become a true practitioner of healing art, so you need to have all this process and you have to be clearly perceive. So perceive means see beyond, going beyond. So what Vijayakar sir has told that to perceive this is at the level of cellular mechanism. And then the sir has made our science very wonderful, connecting with the Hahnemann to the modern era. So this is what sir has made using the all the knowledge of anatomy, physiology, embryology, and that is why we have to understand what is in the interior of the man, what is actually the disease. And then sir has made the materia medica so easy and understanding the man in disease so that we can understand the materia medica. So for that we have understanding the medicinal power. And sir has made that you have to be adapt this with the principle. So that means the principle of homeopathy. There are seven cardinal principle of homeopathy, and that principle has to be followed in each and every cases. So that if you follow this in a proper way, then the recovery must ensure. Recovery is the process only, and for that you have to use the remedy, and that remedy, the choice of the remedy, which is indicated at the time, the dose, and the repetition. So these all are mentioned in organon in a later aphorism, but we have to keep in mind whenever the patient comes to us, we have to understand what is the disease first and what is to be cured in the disease. So this is the symptoms of the disease has to be cured, or the what process is going on inside the body that has to be cured. So sir has beautifully made with the understanding of the miasm that there are only three miasm and there are only three processes going on in the interior of the man. The name of the disease may be any. But Master Hahnemann has also said that the same thing in a classification of the disease, that name may be any. There is no need to classify according to the nomenclature of the disease, but you have to classify according to the processes. So only three processes going on inside the body, and that is one is the physiological process, which is called as inflammations if the defense is going on. The second two process is called as morphological. In this, the structural changes has been happen, and this structural changes happen only in the two directions, one either in the growth or one either in the destructions of the cellular mechanism. So this is if you know this disease in this particular case and then you apply your medicinal knowledge, then it is must that recovery is the only answer, and that is in the very rapid and gentle and permanently. So this is what yesterday we have learned in aphorism number 2. So starting with the sir's book, we are in the another chapter of sir's book, the chapter number 3. Yesterday we have seen the chapter first, chapter second. So what is the direction of the cure? Now, direction of the cure. What are the less important organ and what are more important organ? See, if we know these things in a proper sense, then and then we can understand that we are in the right direction or we are in the wrong direction. So this question is to be arise in each and every homeopath's mind, that what is most important and what is least important. Yesterday we saw a few examples which were given in chapter number 2. So this has been the biggest questions looming in large in front of all homeopaths. The direction of the cure has been laid down by Herring's law of cure with the following coronaries. So Herring has beautifully guided us that cure take place within this process. So what is this? The cure take place with the symptoms disappearing from above downward. inside outward, center to periphery, from more important to less important organ, in the reverse order of their appearance. So we all know these things by just naming the process, that above downward, so from head to foot, inside outward, from center to periphery, from more important to less important organ, and in reverse order of their appearance. So we know these things. But how this beautifully Dr. Vijayakar has made this with the knowledge of embryology, what is called to be above downward, what is from center to periphery, what is from inside out, and which organ are most important in our human body. So this is what we have to understand. So some of these directions seem to be confused, the homeopath, since they apparently contradict each other. So हम एक example देखते हैं. A case of asthma getting better on catarrh in the chest, reducing, followed by dry cough, and further by the sneezing, should be taken as a direction down upwards. Are you getting me? चेस्ट में कैटार ठीक हो गया, वहां से थ्रोट में आ गया, थ्रोट में से नोज में आ गया. So it is something called as from below up. So either it is a wrong direction, or from inside out, it's the right direction. So we homeopath in an initial state are confused because of these things. A second example, the case of hyperacidity and burning in the stomach disappear, and the tingling numbness in the hand appear, is to be taken as direction from inside out or center to periphery. Both direction from both the right direction, or from lesser important organ stomach to the more important nervous system. So it is the right direction or wrong direction. So what sir has beautifully mentioned these things. Similarly, cough and recurrent bronchitis disappearing, only to give rise to a leukoderma on the skin. It is we all call as it is exteriorization of the disease. So it means a good direction, na? Are you all agree with this or bad? Comment in chat box. Yeah, absolutely, it is a bad. Okay. So leukoderma is looking on the exterior, but it is actually going deeper into the skin. So it is a bad. So this and many other questions arise in our mind and confuses us to the extent of neglecting the law of cure. And this non-avoidance of the law of cure on lawlessness in the homeopathic practice is the sole cause of homeopath not being confident in their practice and not ready to accept the risk in emergency cases, infection of the heart and tuberculosis, etc. All on their own, this has unfortunately given homeopathy a rank of auxiliary science. Still in our India, it is considered to be the second line or a complementary medicines, not the first line of treatment. Okay. Science only to be used when there is no immediate risk to life along with other conventional therapy going on. We ourselves belittle the scope of homeopathy due to our ignorance. Many a time in early neophytes who have not seen the cases, so they consider that this cannot be cured with the homeopathy. Even in our college, we used to say that this is in the scope and this is in the limitations of the homeopathy. But actually, it is not like that. The scope and limitations is not the homeopathy. The scope and limitation is the knowledge of homeopathy only. This is what Sir said. So, this ignorance or lack of knowledge of human science, for example, proper anatomy, physiology, embryology, immunology, neuroendocrinology, and human biochemistry, and genetic, etc., have prompted many of us to put forth their own theory of cure to suit our own convenience. But this theory do not stand the test of time and science. So what Sir has made this theory out of this all knowledge. So Sir says, hence after 22 years of his practical experience, in which he include that he had done allopathic practice, a wrong homeopathic practice with a mixing of many specific drugs, and also the prescription based on all possible wrong principles in the homeopathy. And above all, after an in-depth study of human science, for example, embryology, genetics, immunology, and physiology, etc., Sir have been able to set up the chart of progression of the disease, which Sir has seen and experienced again and again in his practice. So this is what we also see in this in our practice, that this is something is we are in the right direction or we are in the wrong directions. So this chart indicates that all that is happening in the human body, whether cure or disease, are mathematical in progression. So this is what very beautifully Sir has made this, that it is sure like maths. 1 plus 1 is equal to 2 in every aspect. Either you are in the earth, you are in the moon, or you are in the Mars. So this is what maths remain the same. So this is a certain order in disorder. Since the disease axis proceed towards deteriorations of the human life and finally death, it is called as disease axis. And the cure axis has to be exactly opposite. That means from human life and death has to be restored towards the normal thing. It is called as cure axis. The cure axis has to be exactly opposite, leading to the appreciation of the living values and healthy life, but not immortality. So, sir also mentioned that once you have given the medicines, it cannot make the person immortal. You know, the life has to has degradations, and it has happened according to the nature's law. So this is what medicine cannot make the person immortal, but we just have to make from disease axis to the cure axis. Hence, this chart of disease can also be used productively like a compass to the gauge, the direction of the Herring's law of cure. So this is very important in this endeavor, that the direction of the cure is very important in each and every case. So we have to make ourselves to understand this process in a better way. When we have this knowledge from above downward, from center to periphery, from within outward, and reverse order of the appearance of the disease in a real sense with the use of embryology and genetics, then and then we can say surely that you are going towards in the right directions. So we are beginning with this chart of separations. We make these chapters today in a short form, and then we conclude this today's session. And from tomorrow onwards, we again read this chapter number 4. Okay. So chapter 4 suggests the chart of 7 layers of separations and the progression of the disease. You have to understand that it is 7 layer of separations or 7 layer of the progression of disease from one door to another door to another door and finally landed into the end. So note, so human being has essentially 7 layer of separation denoted in the chart in order of importance from down upward. So I will share this chart tomorrow with all of you. The least important skin arising from ectoderm is at the bottom of the chart, followed by more and more important level above. Every layer has also sub-level of importance which are not shown in this chart. For example, respiratory tract and gastrointestinal tract, both are in the same level. Okay, but the transfer of the disease from respiratory to GIT is separations. Okay. Urinary tract is still higher in importance. Here it was written ectoderm, but actually it is endoderm. It's a mistake, printing mistake here. So urinary tract is still higher in importance. So we have these three systems in endoderm. One is respiratory, one is GIT, and further one is urinary. So in this endeavor also we have to important which system is most important. GIT is most important than respiratory, urinary is most important than GIT. So this is also Sir has made. The fourth point, the emotions, attitudes, behavior, anxiety, delusion, etc. arising from the secretions in the limbic system. It is a neurotransmitter, it is secreted from the limbic system of the brain. which varies with the varying biochemical reactions at the humoral level and neuroendocrinal level. So neurotransmitter like the serotonin, norepinephrine, which gives rise to sadness and grief, adrenocorticotropic hormone gives rise to fear, encephalin and endorphin gives rise to painlessness, etc., can be secreted and depressed at all levels in the different proportion in a different individual and help us in the individualization. So this is very important aspect of. So this is called as emotional brain. Most of time this has to be used in physiological cases. The fifth point, the mind, the seven layer of separations. The mind is not actually the emotion of the love, fear, anxiety, illusion, delusions, and hallucinations. So affection of the mind means the affection of the basic cell code. It is called the genetic code. So every cell has genetic code which has a two part. The first part is called as basic code common to all living cells, either a plant or animal or man. This is called as inherent genes. And the second is inherited codes, the code inherited from the parents and the species from generation to generations. Okay. So this is giving rise to two things. The basic code having the three mechanisms of the cellular for the survival of the fittest as Darwin suggested. The second is the reproduction, and the third one is the degradation. So this is all encoded in the basic cell. And inherited code means what? The code is inherited from the ancestors or the parents. So we have learned from our ancestors. So this the learning of the genetics are also encoded in the our genes. So right now we are in the era of the Gen Z and Alpha generation, whereas before 2000 it is called as the millennial generations, and before that also there is one generation. So this is what we have to understand, that the each and every generations learn day by day from their experience. So in upcoming generations we do not advise children that you need to learn the using of mobile phone. They directly at the very young age they understand how to operate the mobiles and gadgets and everything. This is because of our inherited genes having the specific memory which is inherited and transferred to our children. So this also beautifully mentioned in our organon by the Master Hahnemann in aphorism number 81, that infecting agent. That means this memory is very infecting. It is transferred from generation to generation, and that is encoded. So from the yesterday, tomorrow we will continue our fifth chapter. So any question up till now? So this is what just a basic reading from our source book, and we have to understand each and everything in a basic way. So all participation, any questions you have, please ask in the comment box. So we will have a question answer session for 10 to 15 minutes. Are you all getting happy with this morning session? Great. So if you have a very small question, that also to be asked, because the questions will give you answer to many. So your silly question can sleep disorders lies at which layer? Okay. So what are the sleep disorders you are going to ask Dr. Chitra? Insomnia. What is the reason behind insomnia? First and foremost thing we have to understand, insomnia is the symptoms, and we put this is as a process. So do we need to treat the individual or do we need to treat symptoms? So okay, fine. Insomnia because of financial insecurity. So it is an emotional outburst. So it is given in the fifth layer due to any emotional upsets like anxiety, fear, fright. It is associated with the APOD system, which we called as amine precursor uptake decarbolism. So in that there is a emotion has to be changed, but it is just a physiological in nature, and that physiology has to be restored soon. Physiology has to be restored soon if you apply a right kind of medicines and understanding the man in a proper way. If arising after operation of the disc listhesis, then suppressing, yes, absolutely. So there are two type of insomnia. One which is called as physiological insomnia because of physiological disorders, and one which is called as a pathological insomnia because the sleep disorder can be classified into these two different phenomena. So when it is a pathological in nature, then it is absolutely suppressing from the third layer to the fifth layer. Absolutely, doctor. This is suppression. The another question raised how to collect information of the genetic mind from the patients. Okay, Dr. Raj, you all know about the classes of SCPH and SCPH plus, but for that you have to understand the basic concept of the man and his from childhood history. So what childhood mind he has. So sir has made this is you have to differentiate the mental from the moral, intellect, and the will. So the first and foremost things the man is evolved, and after evolutions of the man, the first thing comes into this is the moral. See, we all evolve from the unicellular to the multicellular complex mechanism as a man. So same way our brain also evolved, and same way our emotions and system has been evolved. So when the man has evolved, the mammal has been evolved. So before mammal there is a emotions. The emotions are there, but emotions is there in the which we called as in the five sheaths of our koshas, annamay kosha, pranamay kosha, manamay kosha, jnanamay kosha, and vijnanamay kosha, and the bliss sheath, anandamay kosha. So in that the emotion is manamaya kosha. So emotion is there before mammals. So that means the mammal comes, the emotion started. But when the human has evolved from the mammalian system, so in the initial mammal, there is the animal emotions, and then the human emotions comes. When the mammal evolved to the human, the first thing comes is the society and the regulations of the society, and for that he have to understand what is right and what is wrong. So this is what moral is the most important aspect in understanding the genetic mind. So the moral gives the first thing. So that is why Sir has made very particularly in each and every case when Sir is trying to rule in, rule out, Sir rule out with the conscientious and non-conscientious, diligence and non-diligent remedy because this moral gives rise to a genetic code. So first and foremost thing important in genetic mind is a moral. Second aspect is the understanding to survive in this hostile world. That means the intellect. The second aspect of the human is the intellect. So intellect has to be used genetically. So that is the genetic mind. And the third one is finally comes is the will. And then the emotions came into existence for the human mind. So this is what very important aspect of understanding to collect the information from the genetic mind. So you have to understand man as a whole by will, intellect, moral, and then emotions. Hope you got your answer. Dr. Kusum has asked something like, Sir, in case of fracture hairline on ribs and also on a hip, which has major which has major factor. fracture, is it good sign that rib hairline getting healed and then the major fracture of the hip? Absolutely wrong, doctor. The major and minor fracture is not important. The fracture is something called as the syphilitic miasm is persistent in the patients. Okay. So it is the location to location. The still the person is not there in the right directions because fracture is the so first and foremost thing in the corollary, sir has add another corollary in the Haring's law that from the syphilitic miasm to the psychotic and from psychotic to the sora that has to be reversed. So here the fracture on the rib has been better and the fracture on the hip is increasing. That means still the syphilitic miasm is lurking and it is absolutely a bad sign. Okay. Wow, I love this name Dagorc. This is our password. If the patient treated with homeopathy for acidity, he cured. After 2 years, he developed numbness in the limb. You say that it is suppression. Is it only our medicine is wrong or other cause may be possible? Yes, your question is absolutely right. There must be, the human being is affected epigenetically with the many factors. It is not like that. But we have to give idea that if it is acidity and now he has a numbness of limb, so when we are treating the numbness of limb, telling the patient that your acidity might returns and don't do anything for that if you are going in the right directions. Okay, so that is very important aspect in our treatment. So this is what predictive homeopathy tell us, that you have to predict that you have suppressed this from this either medicinally, either psychologically, or either because of some epigenetic factor or conflict arising in their life. Then also there is a different disease has been developed. So whenever you are treating that kind of patient, you have to have giving idea and predict them that this should be come back, and if it is come back, don't treat again because it is for the transient period of time and it will vanish and then you will be cured. So that is what you have to keep in mind. Okay, cause can be any, we may suppress, even allopaths can suppress, so that is the reason. But we have to understand that this is at the fifth layer right now and we have to reverse to the first layer. So this is what we have to understand. Hope you got your answer. Yeah. Any questions? Yes. So all are requested to show your good morning face so I can know that you awake. Yeah. So anyone can unmute and raise your hand and unmute yourself, and then we will have a chat. Welcome, Dr. Priyul Shah, Dr. Kusum.
Morning, sir.
Good morning. Good morning. Yes, Dr. Azil. Unmute yourself and ask. Dr. Azil, you have raised your hand. Anyone want to ask directly, not typing on the chat box? Why I'm making chat box? Because chat box will help me to reread again and then we will have a conversation if any question is left. That is why I advise you to use chat box. I hope you don't have any questions. ऐसा तो हो ही नहीं सकता, क्वेश्चन नहीं है, पर कभी कभी कॉन्फिडेंस और फियर और क्या पूछूं, सब लोग ऑब्जर्व करेंगे, जज करेंगे, ये हमारे दिमाग में चलता रहता है, एंड दैट इज व्हाई वी आर नॉट आस्किंग एनी क्वेश्चंस। कभी कभी एक सिली क्वेश्चन भी किसी की केस निकाल देता है। ठीक है, तो टुडे वी हैव अ टाइम, might be tomorrow we don't have a time to discuss this because we have to read the whole chapter. Any question? Still many are joining and many are left. Okay, fine. Dr. Gargav Jani, તમને તો ક્વેશ્ચન હોય જ છે, એકાદ સવાલ પૂછો.
Good morning, sir.
ગુડ મોર્નિંગ, ગુડ મોર્નિંગ. આપણે જે કન્ટેક્સમાં વાત કરી રહ્યા છીએ એ સિવાય પણ તમે સવાલ પૂછી શકો, એવું કંઈ નથી. So all from different state, they have a little difficulty in conversing the Gujarati, but still I am making our conversation in Hindi and English for a better understanding of everyone. So this journey of reading morning session is the thought came to me for my personal evolutions. Due to my busy schedule of practice, I cannot read books. So many of my students say that मैं जब भी मेरे पास student आते हैं तो I ask them to read search book again and again. So one fine day I thought that मैं ही नहीं पढ़ता, ये लोग कैसे पढ़ेंगे, क्योंकि मुझे टाइम नहीं मिल रहा है. And then I thought that why should I alone read? So I made this online meeting for all of you so that together we will grow. So this is not that you expect all answers from my side only. Any one of you which you knows about the answers, you can share your answers with me, because this is what the evolutions of all the things, not a personal evolutions. Okay, so it will help you. So that is why the idea came into existence that we will have a morning sessions and morning meetings. So our mind is so fresh, and this in the fresh mind we can install our knowledge into our mind, and then this remain for a longer time. So our next generation can know homeopathy better. Hope you understand, because it is inherited in the our genetics. Okay. Any questions? Yes, sir. A very good idea. Thank you, Dr. Kusum, uh, for appreciating the ideas. Uh, Many of the distance learner always asking me in a chat box or a group that sir, something you have to make available for all of us also, because in Surat many of our students, they personally meet us and we have a personal meeting also, so they are beneficial, they are benefited from this. But those distance learner, they always ask sir, make something for us also. So this is what the initiative is for the distance learner also. Great. So we will have 2 minutes left. Any questions? So, and then we have to conclude today's meeting, and tomorrow we will meet again. Hope today is no question. So the things which I need to give you idea that go read and make a questions in your mind that why this is happening, what it is, and why it is, so that tomorrow morning you came with the question. So we will have a good experience of learning, and I might trying myself to solve your questions, because what I learned from Dr. Vijayakar sir is everything is answerable, everything has a cause, everything has a precursors, and everything has idea. So this is what sir has said. So if you have any questions, and if it is possible for my side, I will give you the answers. So make it possible that you should read something and ask yourself, does I understood it in a proper way? What Dr. Raj has asked, Dr. Raj has completed SCPH and SCPH. So still he is asking, that means he has something in mind that when to do this. So this is what you have to reread and what we call as sharpen your knowledge by asking. Okay. So thank you so much for today's sessions. We will continue this morning session tomorrow onwards. Okay. And hope you have many questions. If you have, so we will have the question answer session tomorrow. Thank you. Thank you for joining, and thank you for growing together. Thank you all. Thank you.